Emily Kaltenbach, thank you for joining us on In Focus.
Thank you, Megan. Thanks for the invitation to be here.
You previously worked in this agency, then you went to the Drug Policy Alliance, and now you are back. How have those experiences influenced your vision for the department this time?
Yeah, it really feels amazing to be back. It's been about 15 years since I was with the department, and I made the decision really to move away from state work to learn more about the public policy in the nonprofit sense and do some advocacy in that sense. And so I think I'm bringing back a lot of what I learned out and about during my drug policy days back to the agency. And one of those things is really about listening intently to the community and to the needs of the community and building policy that's very much rooted in what the community needs. And so I'm going to bring that perspective back in this new role.
New Mexico, as I'm sure I don't have to tell you, is facing some serious challenges with our aging population. A series in the Santa Fe New Mexican outlined a lot of these, and it said we could be a poster child for the so-called silver tsunami. How will your department adapt to this in terms of your services and your budget?
Well, we've been adapting for the last couple decades. Again, back to the time I was with the department. I think that was when we started to really recognize the growing number of older adults in our state. And at that point, I think we were fourth in the nation for the percent of those adults over 65. Now we're 13th, and we're going to be 10th in the next 5 years. So there has been an effort to build out the programs and supports that older adults need, but we need to ramp that up. 5 years from now, that's not very far away, and so we're really working on a budget that will support our older adults, primarily around staying in the home and in the community. So that's what our community members want. They want to stay home, live independently with dignity for as long as they can. And so our department's very focused on making sure that they can stay in their home and they have the caregivers to support them.
I wanted to tell you about a situation last year. I was volunteering with St. Vincent de Paul. I was helping a woman who was evicted. She was basically living in someone's backyard for a while, and she was over 60, so she qualified for senior services in Albuquerque. But it seemed like the caseworkers were not really set up to help people who were precariously housed. But we know that the problem of senior homelessness is growing, so it felt a little bit like things were siloed, like seniors over here, homeless things over here. Just wondering how your department is addressing this.
Yeah, that's something that's very near and dear to me, is making sure that all individuals have the housing they need, but particularly our older adults. I would imagine if you go out and out on the streets today, the majority of those folks are over the age of 50 and are in need of stable, affordable housing. And so I look forward to working with my colleagues across state government as well as community members and local government to figure out what's best for our older adults. There shouldn't be a segmentation of senior services and homeless services. I know that there are incredible community partners who are really looking and being very serious about identifying what older adults need. And so we're excited to partner. The governor has been very focused on housing issues and standing up, the Office of Housing and the Department of Housing, and so we're looking forward to working with those folks to specifically address the needs of older adults. There are not enough housing options for older adults that have chronic health issues as well. So we're going to see a lot of adults that need that assisted living level of care and long-term care eventually.
Many of the shelters, as you know, are seeing more seniors, like the West Side Shelter here in Albuquerque. They're not necessarily set up to meet those kinds of complex health needs. How is your agency working with cities and counties to meet those needs?
Yeah, our Adult Protective Services system actually is probably the one division that most often intersects with people who are precariously housed and who need those types of supports. And so we have seen an increase in the need for emergency placements for individuals who are living either on someone's couch or in and out of shelters, in their cars. And so we're going to have to, do better by those folks and really build out some programs. I know Healthcare for the Homeless has recently sort of thought through, like, what do we need for those older adults that have more special needs and advanced level of care. And so, again, we'll be working across our state agencies and with local partners to figure that out. It's something that I don't think our department has focused on as much in the past. And so that's one of the priorities that I hope to bring to the department.
I don't know if this might be a factor in serving this population. Sometimes, I found this the woman I was trying to help, like, well, I'm not really homeless. Like, well, but you're not housed really, and so I just wonder if that's also a complicating factor in working with this population.
Always. I mean, I think we use the term homelessness, but what does that mean? How do we define that? And, I think...
I met a woman when I was volunteering, son, she's clearly living in her car, right?
Yeah.
So.
Right, and maybe that's her, we have to also look at what, our adults' choices of where they live, but we want to be able to support them and wrap services around them. I mean, some of these older adults may actually need a facility-based level of care, right? That is a higher level of care. And so we work to find placements often for folks who may not have the capacity to be making good decisions for themselves. And, how can we work with them and whatever family or what other supports they have to get them in the places that they need. And so our Adult Protective Services staff are amazing. They're not just going out there and responding to abuse, neglect, or exploitation cases.
I didn't know that. That's interesting.
Yeah, they're doing prevention as well, because we know that oftentimes vulnerable adults will end up then facing, unfortunately, abuse, neglect, and exploitation. So.
We have a lot of older folks in rural areas in New Mexico, including your own parents, right?
Yeah, I grew up in rural New Mexico. Yeah, and they still live out that 3-mile dirt road.
Oh my gosh.
Yeah, winters are interesting. But
well, what are the extra challenges these folks face, and how can aging and long-term services work to address those?
Yeah, well, I think we're going to see the growth of older adults. The impact is going to mostly be in our rural areas. A lot of those their family members have left. They're living alone. People leave for economic reasons. They move out. A lot of older adults don't have the support systems that they may have generations ago. And so we need to make sure, again, if their choice is to live in their home, in their community, which, we want to support that. That's at the heart of our mission at our department, is really making sure people can live in their home and community for as long as possible. And so I think the question, one of the issues that comes up are caregivers, both formal and informal caregivers. A lot of these rural communities don't have formal caregiving services, and so that responsibility falls on neighbors and whatever families there, spouses who may be older themselves and facing their own health issues. And so I'm very focused on those older adults. One of the ways, into your question about what our department can do, we have stood up a program called New Mexicare. And that's a governor's initiative that provides financial support and training and services to informal caregivers. So that spouse who is taking care of their loved one, but they may be financially insecure. They can be paid up to $1,400 a month for that caregiving. We need to support our informal caregivers. They're the backbone of our long-term care system. They are often the ones that have the most strain, financial strain, emotional and physical strain of being the caregiver, and so we need to step up and support them. And New Mexicare is an incredible program, and a priority for me to really make sure that it gets rolling across the state.
How is it funded and how will it grow?
Yeah, it's a state-funded program at this point.
From the general fund?
From state
Okay.
general fund. And it is, the eligibility are for individuals who are not on Medicaid.
Okay.
Because, we know a lot of people fall through that gap. So our Medicaid, again, New Mexico does an incredible job of making sure that folks on Medicaid can get home and community-based services. But what about the person who's just over that eligibility limit? And so that's where New Mexicare comes in.
My brother-in-law in California takes care of my husband's sister who has early dementia, and they have something similar here. I think you can qualify
Yeah.
and be the caregiver, and you're compensated for
Yep.
some of that.
Yeah,
So-
it's really, really critical. And because we know that most of our care in our rural areas are being provided by neighbors and loved ones and community members.
Yep. Folks may not understand that your department also helps people with disabilities. What kinds of challenges in New Mexico are we facing in terms of people becoming disabled and needing help?
Yeah, so we not only, we often are called Department of Aging,
Yeah.
we,
And long-term care.
and long-term care. But we, it's all about adults in New Mexico. And the number of adults who may be living with a disability who are getting older themselves. And they also need home and community-based services. So just the same types of services really about caregiving is, one of the areas where there's definitely overlap. We find that oftentimes people living with disabilities may be at higher risk for abuse, neglect, or exploitation, and so supporting them. A really important bill is going through the legislature right now, and it's called supported decision making.
I was going to ask you about that. What is that?
So it's an alternative to guardianship for individuals who who still want to make their own decisions but need a little extra help and support. So we all really have supports in our life, right? If we're making a decision, sometimes we go to, I might call up my brothers and say, what do you think about this? Whether it's around a financial decision or a healthcare decision. And so it really was born out of the developmental disabilities community of adults who want to continue making those decisions, but again, just need a little bit of help. And where full guardianship isn't appropriate.
And full guardianship is literally someone takes over all these things for you.
Exactly.
And we've seen some problems here in New Mexico with that.
And make full decisions. Now, guardianship is still really critical and important part of the system of care for folks, but this is something that's 27 other states now. I think Texas was the first to create supported decision making in their law, and so we're hoping New Mexico will follow suit. And again, it's really an important way to support one's independence and dignity, and research has found that if folks make their own decisions, they're going to learn and become more and more independent from that. So we're excited. So that's for adults who may be living with disability, for older adults, and others.
Especially if they don't have people they can't call a brother, they don't have anyone.
Yeah, or they may decide that their brother, is that supporter to help them make decisions. I mean, how often does someone go into a bank and, the stigma of someone with perhaps some developmental disabilities, it's a really important law for those third parties, whether that's the hospital or the bank, to know that there is a legal system to support these supporters.
We are in the midst of the the legislative session.
Yes, we are.
And among your budget request is $1 million to revive the long-term care division.
Yes.
What would that do?
So I'm really excited about this because when I was with the department, again, 15 years ago, 20 years ago, we ran the home and community-based services programs for Medicaid. So at that point, it lived in Aging and Long-Term Services Department. It makes sense. They're all now in HCA, which is the best home, the healthcare authority, the new healthcare authority. But back to the example of New Mexicare that I was talking about, these are long-term care programs for non-Medicaid individuals. We have a veteran self-directed care program. We have a program that helps transition folks from nursing homes back into the community. But all those programs right now are spread across our department, and they need a home. We need to create a continuum of care in our department that can then be, we can better serve our population. And so we're asking to put those programs together so that we can focus on the long-term care needs, especially with the growing population.
So that's will be a resource for people who have to contemplate long-term care, either in the home, in a facility.
Exactly. And we can, caregiving support and training, we can bring that together so it's centralized, and it'll support our other divisions' work. But at this point, it's just fragmented across the department.
We are facing a lot of uncertainty in federal funding right now, especially with Medicaid. We have over 700,000 people in New Mexico on Medicaid, and many of our programs rely on Medicaid reimbursement to operate. How's your agency preparing for what looks to be an uncertain future?
Yeah, it's very uncertain, and I know there's a lot of fear, and a lot of the folks we serve get served with federal funding. Even though we don't, run and operate those Medicaid programs, we are a door into those programs, and we have navigators and options counselors who are helping adults navigate this very complex system. And so, there is a lot of uncertainty and a lot of fear around that. About a little less of a quarter of our budget is federally funded, and so we're keeping an eye on it. But I want to reassure that we are going to be providing care to our most vulnerable regardless, and so we're going to figure that out. And those important meals that happen at senior centers, and those transportation, those rides to doctor's appointments, and we're going to continue to find a way to do that, because those are the individuals we serve. And so it is an uncertain time, but I'm very committed to making sure, and I know the governor is, to making sure that we are taking care of New Mexicans.
Well, Emily Kaltenbach, thank you for coming on and talking about this.
Thank you, Megan. It's a really, really important issue to our state, and so I look forward to being part of the aging world and making sure New Mexico is a leader in aging.
Thank you so much.
Thank you.